What if I told you that a human heart was replaced, not by the hands of a surgeon but by a robot? Imagine a heart transplant without opening the chest. No large incisions, no months of recovery. This isn't science fiction or futuristic. Robotic surgery is here now. In September 2024, a medical team at King Faisal Hospital and Research Center in Riyadh, Saudi Arabia, achieved the unthinkable. The first fully robotic heart transplant on a 16-year-old patient battling end-stage heart failure. In this video from Health Equals Wellness, we will break down how they did it and why this changes everything. A feat once thought impossible is now a reality, and it could change everything we know about surgery. Traditional heart transplants are highly complex, requiring the steady hands of top surgeons and a large medical team. But in this case, the entire procedure was performed exclusively by a robotic system, with zero direct human intervention. Led by Dr. Faris Khaliel, the team spent 3 days rehearsing 7 times in virtual reality to perfect every movement. The actual surgery lasted just 2.5 hours, all through tiny incisions guided by robotic precision. That means that a robotic surgeon handled the delicate incisions, sutures, and connections with unparalleled precision. AI-driven algorithms helped navigate around tiny blood vessels and tissues. No tremors, no fatigue, just pure robotic accuracy. And the result? A successful transplant, giving this young patient a new chance at life. Dr. Khaliel stated, "Robotics lets us operate with unmatched accuracy." For this patient, avoiding chest opening wasn't just a request, it was a gateway to faster healing. This isn't just a futuristic moment, it's a turning point for medicine, and it might be in your future. As of early 2023, over 11 million robotic surgical procedures had been performed globally using Intuitive Surgical's Da Vinci systems, with more than 7,500 systems in use. While specific data for the total number of robotic surgeries performed in 2024 is not readily available, the trend indicates a continued increase in the adoption of robotic-assisted surgeries across various medical specialties. This growth is reflected in the surgical robots market, which was valued at approximately $4.31 billion in 2024, and is projected to grow at a compound annual growth rate, CAGR, of 9.42% from 2025 to 2030. By 2024, robotic-assisted surgery had expanded across multiple surgical specialties, including urology, gynecology, general surgery, colorectal and thoracic procedures. The adoption of robotic surgery by hospitals continued to grow, with usage increasing from 1.8% to 15.1% for all general surgery procedures across 73 hospitals. Here are several reasons why robotic surgery is changing the health industry. Reason number 1. Robots can perform with superhuman speed and precision, reducing risks during surgery. Unlike traditional open surgery, which requires prolonged standing and holding instruments, robotic surgery allows surgeons to operate comfortably from a seated position at the surgical console. Even the best surgeons get tired during a long surgical operation. Robotic systems don't. They work with absolute consistency. This reduced time also reduces recovery time, going from weeks or months to days or weeks. Reason number 2. Enhanced precision and accuracy. Robotic surgical systems provide surgeons with enhanced dexterity, allowing for 360-degree rotation of instruments. This increased precision enables surgeons to perform intricate tasks with sub-millimeter accuracy, minimizing tissue damage and optimizing surgical outcomes. Robotic systems offer high-quality 3D visualization of the surgical field, providing surgeons with superior depth perception and spatial awareness compared to traditional 2D laparoscopy. Reason number 3. Minimally invasive approach. Robotic surgery typically requires smaller incisions than traditional open surgery, resulting in less pain, reduced scarring, and a lower risk of infection. These smaller incisions contribute to faster recovery times and improved patient cosmetic outcomes. With traditional surgery, an incision for a heart transplant can be 10 to 12 inches, whereas with robotic surgery, this can be reduced to 1 inch or less. The minimally invasive approach reduces the complications of infection and significantly reduces blood loss. Robotic surgery offers global accessibility. Robotic surgery has the potential to make surgery more globally accessible, particularly in low and middle-income countries, LMICs, but significant challenges exist to overcome. Here are 4 ways how robotic surgery could improve global access to surgical care. Number 1. Telesurgery and remote operations. Robotic systems enable surgeons to operate from a distance, potentially allowing experienced surgeons to perform procedures in underserved areas without being physically present. This could help bridge the gap in surgical expertise between high-income countries, HICs, and LMICs. Number 2. Improved surgical capabilities. Robotic surgery can enable more complex procedures to be performed minimally invasively, potentially expanding the range of surgeries available in resource-limited settings. Number 3. Training and education. Robotic systems can serve as educational tools, allowing surgeons and LMICs to learn advanced techniques and potentially reducing inequity in surgical access and delivery. Number 4. Centralized expertise. Institutions with robotic surgical systems could act as local hubs for education, research, and clinical support across a country or region. However, several challenges need to be addressed. Cost. The high cost of robotic systems and per-procedure expenses remain significant barriers to adoption in LMICs. Infrastructure. Many rural and underserved areas lack the necessary technological infrastructure, including reliable high-speed internet for telesurgery. Equity concerns. Without careful implementation, robotic surgery could exacerbate healthcare disparities by being accessible only to wealthy communities. To make robotic surgery truly globally accessible, strategies such as cost reduction, infrastructure development, comprehensive training programs, and equitable distribution of resources will be crucial. While challenges remain, the potential for robotic surgery to improve global surgical care is significant, especially when combined with other efforts to strengthen healthcare systems in LMICs. This revolutionary robotic heart transplant proves that the future of medicine is here. So, what's next? Could fully robotic brain surgery be next? Could AI doctors diagnose and operate with no human input? Would you trust a robot to perform life-saving surgery on you? Drop a comment below and make sure to hit that like button. And subscribe for more mind-blowing medical breakthroughs from Health Equals Wellness.